Hi, Alvin DeLeon here, and you are watching episode 61 of the 3-Minute Health Tip. And in this episode, I'm going to talk about osteoporosis. Now, conventionally, we all learn that osteoporosis is a condition that tends to affect women as they go through menopause, as they age. And that osteoporosis has to do with the brittle bones, making women, as they age, elderly women, more prone to fractures. And we also learned that this is often due to a decrease in estrogen levels as women go through menopause that leads to these changes that affects the quality of the bone. And that our diet can influence this as well, that the lack of calcium in our diet can cause a brittleness of the bones, leading to a diagnosis of osteoporosis. Now, looking at osteoporosis from a G&M perspective and the knowledge of the 5 biological laws, we're not just going to focus on the bones, but we're also going to focus on what's happening at the brain level and what biological conflict is affecting the psyche that triggers the osteoporosis symptoms. And so from a G&M perspective, again, the bones are what we're looking at, the skeletal bones themselves, and that's controlled from the part of the brain known as the cerebral medulla. And the biological conflict that a woman goes through, or somebody that's dealing with osteoporosis, usually goes through what's known as a generalized self-devaluation conflict. A generalized self-devaluation is usually related with almost like a slow devaluation, a slow feeling of low self-worth, that you're not worth it, that you're not valued, that you're not able to contribute anymore. And so as you can imagine, based on the culture that we grew up, especially in the Western culture, there's a huge amount of pressure for women, even as they age, to be able to maintain their beauty, their relevance, their responsibilities, their ability to contribute. And so there's a lot of devaluation that certain women, not all women, as they age, particularly because of the messages that we get that, you're not supposed to get old, that you're supposed to continue to look young, that you're supposed to continue to maintain your fitness, your beauty, your looks, and your ability to take care of your family. And so this leads to certain cultures being more prone to these generalized self-devaluation conflicts affecting the cerebral medulla, causing changes to the bone marrow, leading to an osteoporosis diagnosis. The osteoporosis actually shows up in the conflict active phase, while that person is still feeling devalued, because the ulceration of the bone marrow takes place during the active phase, while they're not feeling valued in their family, in their society, or in their job. So this is important to understand, and so today's health tip goes out to all of you, especially the women, even though this can also happen in men, to be conscious of how you're seeing yourself, how you're being viewed in your own family, in your life, in terms of the pressures that you're feeling you have to live up to. There are already moments now that you're feeling devalued. Can you look at those situations differently? Can you honor where you are, who you are, how you are in your life right now, in order to avoid potentially dealing with this self-devaluation as you age? I encourage you to learn more, because the younger and the earlier that you learn it, the better in terms of helping you deal with the symptoms that potentially show up as you get older. So I want to thank you for your attention as always. I'll see you at the next episode.